Containing the spread of COVID has massively started with presidential pronouncements declaring partial lockdowns and curfews. During these periods, pregnancies have allegedly escalated in the country. More on the escalation of pregnancies during the COVID-19 lockdown, the National Coordinator Think Young Women, Musubako Tosawa, and Senior Nursing Officer Majula Kinte of the Bunung Maternal and Child Hospital shared their versions on major causes of such pregnancies.
When the curfew happened, it meant that people were forced to live together in the households, and that would also mean an aggregation of certain individuals who are in very violent relationships were forced to sit together and spend more time together.
20% of deliveries have increased for the first quarter of 2021. So that's like we are expecting more, because you can see in the world now, it's almost full with deliveries, and more are coming. So sometimes before the end of the day, we have we have about 10, 20 deliveries at night. So it's like sometimes, and then normal circumstances, September, October, November, December is the peak period.
Since a presidential declaration on the night of the curfew from August to December 2020, 2,003 deliveries were made at the Bunung Maternal and Child Hospital, while 1,417 babies were successfully delivered during the first quarter of 2021. And the facility is expecting a higher number of newborns in the second quarter of the year, says Majula Kinte, a senior nursing officer and midwife.
The lockdown was very effective in April, May, June. So from the pregnancies that are starts from those months, at the end will all fall into 2021. So for that being the case, we are expecting more deliveries this year than all other years.
National Coordinator of Think Young Women, Musubako Tosawa, outlined the impact the curfew had on women and girls.
If you are someone who is on contraceptives and during the lockdown you're not able to access your caregiver or your healthcare provider, that would also mean not being able to access that contraceptive, and consequently that could lead to unplanned pregnancies.
The government of the Gambia and partners are closely working to address maternal and infant health challenges in the country through the hiring of quality medical staff and procurement of life-saving equipment. Sainabou for GRTS News.